The diagnosis of pericarditis is made based on finding two of the following four features. Number one is the classic pain. That's going to be sharp, it's going to be positional, and it's going to radiate to the trapezius ridge. Number two is the presence of a pericardial friction rub. Number three is the presence of a pericardial effusion. And then finally, number four are the classic ECG changes: diffuse ST elevations without reciprocal changes and PR depression. The problem is with that fourth criteria, because the pericardium is electrocardiographically silent. If we're seeing pericarditis with ECG changes, what we're actually looking at is pericarditis with epicardial involvement. Now, does that mean that we have been diagnosing patients with pericarditis that have ECG changes and sending them home to die? Probably not. The best data that we have from this 2022 study shows that in patients with pericarditis and ECG changes, there was no association with worse outcomes. What does it mean in terms of workup? If you have a patient with pericarditis and ECG changes, obtaining a troponin is pretty reasonable. And we expect a mildly elevated troponin, but it shouldn't be rising. If that first troponin is significantly elevated, or you're seeing a rapidly rising troponin, we should be worried about myocarditis or possibly a missed MI. Those patients with significant troponin elevations or rising troponins are going to need to be admitted to the hospital, get an echo, get a cardiology consultation, and they're going to need to be observed to make sure that their myocarditis doesn't decompensate.